NASA, we are receiving bidirectional communication from Juice Network's Phasor space satellite servicer currently located in Leo. The Google Lunar X Prize German robot located on the moon's surface at Oceanus Procellaron 3.014 south and 23.419 west. Communication states hit Health Disparities in Baltimore, Maryland, area codes 21216, 21217, 21223, and 21229. How shall we proceed?
This is NASA. Juxtopia entered a Space Act agreement with NASA Goddard Space Flight Center to license its technologies into Juice Network products. Mission Hit Disparities is authorized. Copy.
Roger that. Authorizing. Over and out.
Check it. Martina lunch. Hey, everybody put their hands up. Everybody gon' stand up. Juxtopia's here. Got everybody starstruck, building and thinking, engineering and dreaming. I swear they all on a mission to paint the world in their vision. And I feel so optimistic these people will make a difference. Teenagers working with NASA and helping saving these children, preventing asthma attacks and building pumps. Juxtopia will give you what you want. Juxtopia is working towards utopia and making better change. I swear I ain't no Pinocchio. I'm just saying what it is. I ain't running over ya. Looking like some millionaires if you're looking close enough. Can't be like the most of y'all. We come through and start dropping, just stopping cars and popping up and flying in these astronauts. Hey, everybody put their hands up. Everybody gon' stand up. Juxtopia's here. Got everybody starstruck.
Thanks to Juxtopia's Mavis Swarm, this child was saved.
According to Lieutenant Governor of Maryland, Maryland is plight with disparities in healthcare and health outcomes among racial and ethnic groups. In comparison to Maryland's white population, minorities are dying significantly from preventable illnesses, injuries, and diseases. African Americans suffer from infant mortality rates 3 times higher, have new HIV infections at almost 12 times higher, twice as likely to lack health insurance, and die of asthma at a rate twice as high. Hispanics are over 4 times more likely not to have health insurance. American Indians are 3 times more likely to experience end-stage kidney disease. More disturbing, cardiovascular disease and strokes are leading causes of death for Baltimore residents, claiming more than 2,000 lives each year. There is a solution to this painful problem. Every day, young Juxtopia engineering apprentices trained in the art and science of engineering and entrepreneurship execute their mission to innovate science and technology solutions that prevent health disparities in Maryland from within secret juice labs across this great state. I know because I trained them. So when you see or talk with a person suffering from health disparity, know that there are Juxtopia engineering apprentices working each day to deliver the next generation of healthcare to make certain Maryland populations suffering from health disparities never suffer again.
This segment is sponsored by
The JET recruits have had their 8 weeks of the rigorous training, right? So what we want to do first is talk about and decide who we're going to accept into the JET core group.
Well, the strongest out of all those 3, I would say Valenke, because in a demonstration, she would answer the most questions and she was informative about everything she was doing.
As being the strongest, I would say Valenke, just for the faith. She has potential, so she wasn't as strong to see that she is strong and has the potential to be a lot stronger. Tavon, he just lacks a lot of confidence in his code, and it's kind of like he gives up easily.
Be equitable bring everybody into the lab, but we want to choose the best. Mr. Armstrong, thank you for coming to the Juice Lab and bringing your asthma pumps and talking about the healthcare disparity asthma. From our last discussion, what I believe to be the problems are inability to keep track of the asthma pump all the time, right? Sometimes a child may over-medicate with the asthma pump, right? And a parent or a pediatrician may not even know if the child is taking the medication, right, in a timely fashion.
I would say those would be the top three and the most critical, because when you're talking about children who sometimes may not understand or know, or it depends on how critical the asthma is, because asthma, some people have it severely, some people have it maybe just when they get a cold. So it just depends on, the level of asthma.
Got it. We have three problems, right, critical problems, focused on the asthma pump that we're going to solve. The last session, we came up with some great ideas during our brainstorming session. In today's session, right, what we're going to do is split up in two groups, okay? This is called like a jigsaw method. Then we're going to come up with solutions for those three problems. First problem, children leave their asthma pumps behind very frequently. Second problem, the asthma pumps right now don't give you a great indicator of how much of the medication that you are inhaling, right? And there may be a threat of over-medication. Third problem is a pediatrician or parent or guardian doesn't even really know if the child is taking the asthma, taking the medication from the asthma pump, right? But with our knowledge in health informatics, information technology, software engineering systems, and our creativity, we should be able to solve those three problems within about, let's say, 15 to 20 minutes. Okay? Everybody understand? All right, let's break.
The Jets. Y'all, I appreciate everything that you all doing. Y'all doing a fantastic job, and I want to thank you once again for helping the Abiona group and working on this telehealth product. And you all are doing fantabulous. Thank you.
Continue to watch Jolt TV and interact with the Jet Corps to help create an innovative solution that prevents asthma disparities in Maryland.